Hi, my name's Aidan. I'm going to be your nurse today. Could you tell me your name and date of birth?
My name is Jessica Pietchik and my date of birth is 010800.
And could you tell me the reason for your visit today?
A checkup.
Okay, and according to the doctor's orders, we're going to be doing a head-to-toe assessment today. Is that okay?
Yes.
And now I provide privacy for the patient by closing the door or closing the curtains. And we're going to start with the skin and hair. And the skin is normal for race and ethnicity and color. There's no lesions present on the skin, and the skin is not impaired in any way. Upon palpation of the hair is distributed evenly with normal thickness, and it is brown and blonde in color and shoulder length. Now we're going to move on to the neurological section. And upon inspection, the patient is sitting upright in a calm position. The patient is dressed appropriately for the season, and the patient has a calm facial expression. Could you tell me your name?
Jessica.
And could you tell me the day of the week?
Sunday.
And could you tell me what state you live in?
Michigan.
Okay, good. And could you formulate a random sentence for me?
The cat runs up the tree.
Okay, good. The patient is alert and oriented to person, place, and time, and the thought process is logical. Now we're going to move on to the head section of the assessment. Is there anything I should know? Have you had any head injuries or concussions previously?
No.
Okay, and we're going to start with inspection and palpation of the head. The head is normalocephic and atraumatic, round and symmetrical in shape. And could you clench your jaw? Good. And could you puff up your cheeks? Good. And could you raise your eyebrows? Good. Cranial nerves 5 and 7 are intact. Now we're going to move to the neck portion of the assessment. Have you had any neck injuries or surgeries in the past?
No.
Okay. We're going to start with palpation of the carotid artery on both sides. Good, and the carotid artery is 2+ and equal bilaterally. And now we're going to palpate the lymph nodes. We have the preauricular, the postauricular, the occipital, the submental, submandibular, jugulodigastric, superficial cervical, deep cervical, posterior cervical, and supraclavicular. And there is no tenderness noted upon palpation of the lymph nodes. And could you lift your head at a 45-degree angle? Good. And there's no jugular vein distension noted. And now I'm just going to auscultate the carotid arteries with the bowel of the stethoscope. Good, and there is no bruits noted. Next, we're going to inspect the thyroid gland. Could you tilt your head up again for me? Good. The trachea is not deviated from the midline and the thyroid is not palpable. After the neck, we're going to move to the eyes. Do you wear glasses or contacts?
No.
Have you had any previous eye injuries or surgeries?
No.
Okay. And now I'm just going to inspect the eyes and the surrounding structures. The eyelashes and eyebrows are symmetrical. And do you mind if I just pull down? The conjunctiva are pink, the sclera are white, and the eyes are blue in color. And now we're just going to do a couple tests. Is that okay?
Mm-hmm.
I'm just going to look at the size of your eyes real quick. The pupils are round and 4 millimeters in diameter. And we're just going to shine the light into your eye real quick. Just look straight ahead. Good, and the pupils retract to light. And now follow this pen light in towards your nose and back out. Good. The pupils are equal, round, reactive to light, and accommodate. And now I just want you to follow the pen light in the direction it goes. Move only your eyes and not your head, okay? Good. Good. Cranial nerves 3, 4, and 6 are intact. And now we're going to do the Snellen eye test. I'm just going to ask you how many fingers I'm holding up and just respond, okay?
Okay. 1.
Good.
3.
Good.
5.
Good. Cranial nerve 2 is intact. Next, we're going to move on to the mouth. And I'm just going to start by inspecting the lips and the teeth. And could you open your mouth? Good. And the lips are pink with no lesions and the teeth are intact. Could you stick your tongue out and say ah? And could you move it side to side? The gums, tongue, buccal mucosa, soft palate, and hard palate and uvula are all pink with no lesions. The tonsils are 2+, and cranial nerves 9, 10, and 12 are intact. Next, we're going to move to the ears. Do you mind if I have a look in your ears?
Go ahead.
Good. And there's no drainage noted. The ears are symmetrical. And now I'm just going to palpate the tragus mastoid process in pinna. Is that okay?
Mm-hmm.
And any pain?
No.
And there's no tenderness noted. Now we're going to move on to the nose. Have you had any nose injuries or surgeries in the past?
No.
Good. Okay, we're going to do a patency test. Could you cover one nostril and blow in the other? Good. And the other? Good. Patency is normal. And the nose is symmetric and not deviated from the midline. And now we're going to do a smell test. Could you close your eyes and tell me what you smell?
Hand sanitizer.
Good. Cranial nerve 1 is intact. Now we're going to move to the anterior side of the chest. I'm going to start with inspection. The patient's facial expression is calm for the situation. The patient is not using accessory muscles to breathe, and there's no thrills or heaves noted. We're going to start with percussion of the anterior chest over the entire lung field. And the vibrations were equal throughout. And now we're going to auscultate with the diaphragm of the stethoscope over the lung fields. And just take a deep breath for me each time. Good, and there was no advantageous sounds noted. And now we're going to listen to the heart sounds. Is that okay?
Mm-hmm.
Okay, we're going to listen in 5 locations, following a Z pattern, starting with the aortic, moving to the pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are present and regular, and there's no irregular sounds noted. Now we're going to move on to the posterior chest. And could you just move your hair for me? Thank you. We're going to start off with inspection. The AP to transverse diameter is 1 to 2, and we're going to see if breathing is symmetric. And could you take a deep breath for me? And breath expansion is symmetric. And now we're going to move on to percussion. Of the 9 lung fields. And vibrations were diminishing as we went down. And now, could you just say 99 for me?
99.
Again?
99.
Again?
99.
One more time?
99.
And the vibrations were diminishing as we went down the back, and there was no crepitus noted. And now we're going to auscultate over the lung fields, just as we percussed, using the diaphragm of the stethoscope. And could you just take a deep breath for me each time? And there is no advantageous sounds present. Now we're going to move on to the abdomen and pelvis section. Do you have any dietary concerns?
No.
Do you have a history of any abdominal diseases or surgeries?
No.
And do you have any urinary concerns?
No.
Okay, could I have you lay down on this so we could do an inspection of the abdomen? Okay, we're going to start with inspection. And if I can just lift up your shirt. Okay, the abdomen is flat in contour. It is symmetric. There's no lesions present. The color is normal for ethnicity and the umbilicus is inverted. And now we're going to auscultate. Is that okay?
Yes.
Okay. We're going to be listening with the diaphragm of the stethoscope for bowel sounds here. Starting in the right lower quadrant, then the right upper quadrant, then the left upper quadrant, and finally the left lower quadrant. And bowel sounds were active in all 4 quadrants. And now we're going to be using the bell of the stethoscope to listen for brutes and the aortic, renal, and iliac arteries. And there was none noted. And now we're going to move to percussion of the abdomen, following the same pattern. And the vibrations were equal. And now we're going to do palpation. We're going to do light and deep palpation. Is that okay?
Mm-hmm.
Okay. Was there any pain during the light palpation?
No.
Okay, we're going to move to the deep palpation now. And was there any pain?
No.
And there was no tenderness noted during the inspection. Okay, can I have you sit up for me? And we're going to go back to the chair. And now we're going to do an assessment of the arms. Have you had any numbness or tingling in your arms?
No.
And may I inspect them? The arms are symmetric and the color is normal for race and ethnicity. And the arms are cool to touch with no edema present. Capillary refill is less than 3 seconds. And I'm just going to check your pulses now. The brachial and radial pulses are 2+ equal bilaterally and regular in rhythm. And now we're going to move on to some tests. Could you grasp my fingers? Good. Grip strength is normal. And could you push against my hands? And then pull against my hands? Good. Hand strength is normal as well. And now we're going to move on to the leg portion. Could I ask you to take off your socks?
Okay.
And we're going to start with inspection of the legs. And they are symmetric and color is normal for race and ethnicity. There is no edema present upon palpation. The legs are cool to touch and capillary refill is less than 3 seconds. Now we're going to check the pulse sites. The posterior tibial is 2+ and regular, equal bilaterally. The dorsalis pedis is 2+ equal bilaterally. And the popliteal is 2+ equal bilaterally. Now could I have you push on my hands and pull? Good. And now we're going to do a sharp dull test. Could you close your eyes for me and I'm going to poke you lightly and you tell me if you feel sharp or dull.
Okay.
And can I just see your foot? Okay.
Sharp.
Good.
Dull.
Good.
Sharp.
Good. And you can put your socks back on.
Okay.
And now we're going to move on to the musculoskeletal portion. For this portion, could I have you stand up? And could I just have you walk back and forth? Good. The gait is normal and not impaired. And now could I have you close your eyes and put your hands on your side and balance? And we're going to go for 20 seconds, okay? Good. Good. You can open your eyes now. The Romberg test is negative. And now, could I have you rub one heel on your shin like this? Good. And the other foot? Good. And could I have you sit down again? Good. And I'm just going to check the plantar reflex in your foot. And the plantar reflex is present. And now I'm going to have you start with your finger on your nose and bring it to my finger. And then back to your nose and back to my finger, okay? Good. Good. And now we're going to check the range of motion in your joints. Do you have any previous joint issues?
No.
Okay. And could you bend your ankles in a circle? Good. And the other one? Good. And could you bend and then extend your legs? Good. And your arms? Good. And around? Good. And the other way? And could you do head? Good. And then we're going to do that with resistance. Turn to this side. Good. Good. And could you shrug your shoulders? Good. Cranial nerve 11 is intact. And full range of motion in all joints. And now we're going to move on to patient education. Do you know anything about a self-skin assessment?
No.
Okay, well, you should be doing a self-skin assessment once a month, and you should be inspecting your skin for any new lesions or moles or abrasions, and you should be comfortable with your skin to know what a new lesion or mole looks like. Okay?
Okay.
Thank you.
Thank you.